What is Parkinson's disease? It is also known as PD. It is a degenerative disorder of the central nervous system that often impairs the sufferer's motor skills and speech, as well as other functions. It is the most common cause of chronic progressive Parkinsonism, a term which refers to the syndrome of tremor, rigidity, bradykinesia, and postural instability. The disease is named after English physician James Parkinson.
The cause of Parkinson's is unknown, although scientists do suspect that both genetics and exposure to environmental toxins may play a role. Parkinson's disease results in part from a shortage of the brain chemical dopamine. Dopamine stimulates receptors in the basal ganglia, a part of the brain that controls motor functions and emotions. In people with Parkinson's, however, 70% or more of these dopamine cells have died. As a result, movement becomes very difficult.
Signs and symptoms. Parkinson's disease affects body movements. Typically, other symptoms include disorder of mood, behavior, thinking, and sensation.
Parkinsonism is a symptom complex composed of 4 different cardinal sets of signs and symptoms. The first of these is tremor. Tremor is an abnormal involuntary movement which consists of alternating rhythmic involvement of the agonist and antagonist at any one joint. This gentleman demonstrates tremor of both upper extremities, both lower extremities, and his jaw. The tremor of Parkinsonism is characteristically present at rest and ameliorated at least in part by the initiation of purposeful movement. Although tremor is perhaps the best known of the signs and symptoms of Parkinsonism, it is not invariably present. The presence, however, of a rest tremor like this is pathognomonic of Parkinsonism. Here we see the tremor of both hands ameliorated by the initiation of purposeful movement, and the recurrence of the tremor after the hands rest on the knees. This is the classic rest tremor of Parkinsonism. Throughout these hand motions, the tremor of the jaw persists. Again, we see purposeful movement ameliorating the tremor in the hands, while the jaw tremor persists and the hand tremor returns following the purposeful movement. Second of the cardinal signs and symptoms of Parkinsonism. Akinesia refers to difficulty in initiating and carrying out purposeful movements. The term bradykinesia or hyperkinesia are also used, but are really synonymous with akinesia. Here we have the same gentleman having difficulty initiating standing from a seating position. Now the gentleman is seated in a chair that is higher, that is easier for a Parkinson patient to get out of. The same patient with his rest tremor initiating gait. Steps are small, shuffling. Turning is accomplished with many small steps. Again, initiates movements with slow, small steps. There's also a lack of swinging of the arms, what is known as decreased associated movements during walking. Again, the small shuffling steps of a Parkinson patient. When Parkinson patients are asked to step over lines, however, they can walk with a fairly normal gait. And again, we see the normal gait there and the small shuffling steps when he walks without the guidance of lines. And turning with many small steps and a lack of another manifestation of the akinesia of Parkinsonism is the mask and none of the normal play of expression that we see on a normal face. He also tends to stare without blinking, a phenomenon known as a reptilian stare.
Disease for 20 years. Can no longer drive. Sometimes I can't walk. Sometimes I have to be pushed around in a wheelchair. I fear that I will have to have somebody looking after me. and I don't want that because I'm very independent. You can't do what you thought you were going to do before. Try and understand us before you judge us.
Carbidopa-levodopa is a combination drug used to treat Parkinson's disease. And how it works is the levodopa portion increases the brain's dopamine levels. And the carbidopa portion, it prevents your body from breaking down the levodopa. So you get more levodopa in the body. The dosage on this is very individualized. It's catered to each individual patient. If you happen to forget and miss your dose, if it's closer to your next dose, just go ahead and skip it. If not, go ahead and take it. But don't double up and take 2 doses at the same time. You can take the carbidopa-levodopa with or without food, it doesn't matter. If it upsets your stomach, a couple crackers or a small piece of bread is usually enough. You also do not want to crush the extended release portion of this particular drug. You want to store the carbidopa-levodopa in a cool, dry place. A closed closet is a good place to keep medication. A couple of side effects, some stomach upset. Also, on rare occasions, it has been known to cause some involuntary movements, also known as like tics. That comes in several different strengths and colors depending on the generic manufacturer, and it also comes in an extended release form.
Anticholinergics. They decrease the activity of another neurotransmitter that controls movement called acetylcholine to balance out the production of dopamine and acetylcholine. It is also used in mild Parkinson's disease that consists of tremor at rest and can often be treated.
The disease known as Parkinson's is not curable. There are a number of treatments that can help sufferers lead healthy lives. So please, talk to your doctor if you have concerns about Parkinson's.